Hello and welcome, viewers, to another exciting episode of Heart to Heart Health Chat Show. I'm Dr. Ranjita Sengupta. I'm an invasive cardiologist in Bridgewater, and I'm your host. This is our third episode in our month of cardiology, and I'm very happy that I have with me Dr. Alexander Ivanov. He's an electrophysiologist and cardiologist practicing in Bridgewater. Today, we are going to talk about palpitations, approach to treatment, and what you can do at home or at your doctor's office to know about palpitations. A little bit about Dr. Ivanov. He started his training in Russia, very exciting, then came to the US for advanced training in electrophysiology. And even more, he traveled all the way to Italy to train with one of the gurus in electrical rhythm problems, Dr. Papone. So again, friends, please help me welcome Dr. Ivanov. Alex, welcome to our show.
Thanks for having me, Ranjita.
So Alex, can you tell us what exactly do you mean by palpitations?
Well, palpitations is a sensation of abnormal heartbeat in your chest. It may feel as a very rapid and regular heartbeat, or it may feel as a slow and forceful heartbeat, or a skipped heartbeat as a flip-flop. Sometimes it may feel as fluttering in your chest. So all those sensations of abnormal heartbeat in your chest are called palpitations.
Well, thank you again for explaining that. Sometimes patients come to me and say, they are not able to differentiate whether their heart is racing or there is a muscular tremor or is it something else. So what do you tell patients in that kind of symptoms, how to differentiate between whether they are feeling palpitations or this is a tremor of their muscles or it's something else?
Well, the best way to tell is to check your pulse. And sometimes people learn to check their pulses on their wrist or
Right.
on their
On the neck.
carotid artery.
Right.
And if they do it when their heart is beating normally, then they can tell if the heart is beating abnormally fast
Right.
or irregularly when
Exactly.
they feel palpitations. Another way to detect that it's a real abnormal heartbeat or some other abnormal sensation in your chest is to record an electrocardiogram. Some of the contemporary iPhones allow us to record a simple electrocardiogram, just putting your two thumbs on the screen.
Right. Hold on your thought because that's one of our future questions. So let's go on to the next question as, is there any way that patients can stop their palpitations at home or what should they do at home to alleviate their symptoms?
If you feel dizzy, if you suddenly feel very short of breath, if you pass out, God forbid, or if you have any other severe, unusual symptoms that accompany your
Right.
palpitations, you simply need to call 911 and emergently get to the hospital. However, if you feel fine and you just feel abnormal fluttering in the chest or
Right.
skipped heartbeats,
Right.
and you know that your heart is healthy, then you can take a breath. And sometimes some palpitations may be helped by simply relaxing or waiting for a few minutes or taking a deep breath, holding your breath and straining down.
Right.
Sometimes it helps, a lot of times it doesn't.
Right. Right.
Once again, the most important question is how well or how bad you feel when you're having palpitations.
Exactly. And Alex, I completely agree with you on your thoughts about how well do you feel because, in my practice, I always tell my patients, listen to your body. God is an amazing scientist. The way He has made our body always gives you signs and symptoms. So listen to your body. Don't ignore the fact that you're a little dizzy, you're a little sweaty, you're feeling a little clammy, you're having a little bit of chest pain, you're huffing and puffing a little bit. Listen to your body. So we were talking about what are the approaches to palpitation, what causes atrial fibrillation, and now we're going to talk about the treatment approaches. So Alex, welcome back again. Can you educate us what are the treatment approaches to atrial fibrillation?
Well, that is a very important question
Right.
that I hear every day from my patients.
Right.
Well, when we talk about therapy for atrial fibrillation, we need to assess three critical issues.
Right.
One, and the most important, is prevention of blood clot formation in the heart.
Exactly.
Remember, I mentioned that the top chambers of the heart in atrial fibrillation quiver like that. So
Right.
the blood moves very slowly through the top chambers of the heart and tends to stagnate.
Like sludge
And-
formation almost.
And then the blood clots may form.
Right.
And the most dangerous consequence of atrial fibrillation is when those blood clots come out of the heart, go up to the brain, clog the artery, and give you a stroke. So when we see patients with atrial fibrillation, we always first try to decide, do they need a blood thinning medicine and which kind?
Exactly.
It's a somewhat complicated issue that should be deferred to probably specialists as cardiologists.
Right.
And we do it either with the drugs, and sometimes when the drugs are impossible, we do it with special devices that protect the heart from the blood clots that form in the top chambers.
The Watchman device you're
The
talking
Watchman
about, right?
device
We
or
see it on
similar
TV being
devices.
advertised all the time.
Yes. Second area that we need to address in any patient with atrial fibrillation is to relax the heart, to make sure that the heart is not beating too fast, too irregular, and too suboptimal. So they feel better, they're not as tired, as short of breath. And we do it with medications that simply slow down and relax the heart.
Right.
We call them beta blockers or some calcium channel blockers.
Right.
And the third area of therapy for atrial fibrillation is keeping the patient in normal, regular heartbeat.
Right.
If the patient is symptomatic, if the patient doesn't feel well when they're in atrial fibrillation, we try to control atrial fibrillation and prevent it from coming back. And we do it two ways. One is with medications.
Right.
We call them anti-arrhythmic medications. They prevent atrial fibrillation. They don't just relax and slow down the heart. The problem with them is that they're not very effective.
That's
They
true.
work maybe 40% of the time. So if you're in the lucky 40%, you will be okay. If you're in the unlucky 60%, we will increase the antiarrhythmic dosage, we'll switch them around, but unfortunately the patient will have more and more of atrial fibrillation.
And side effects too from the drugs.
And unfortunately, approximately 30% of people on antiarrhythmic medications
They have
develop
side effects.
significant side effects that make us stop the medicines. And another approach to keeping the patient in normal, regular heartbeat is a special procedure called ablation. It's a little bit similar to cardiac catheterization when we put the patient into a comfortable state. I prefer general anesthesia,
Right.
so the patient is comfortable. And from the groins, after numbing up the groins, we put tiny little electrical wires to the heart. And we position them in the strategical places. And with one of the wires, we look for those areas that fire abnormally and create this irregular chaotic activity in the top chambers.
Right.
And we try to eliminate them. And we do it by delivering most of the time heat. Energy. It's not that hot. It's approximately 45 degrees Celsius. Or sometimes by using freezing, cold energy. So we killed the abnormal tissue, preventing all this chaotic electrical activity from spreading to the heart. And that prevents atrial fibrillation.
It's almost like laser kind of thing.
A little bit, and actually, interestingly enough, there is a research on laser ablations.
Right.
So far, it didn't pan out very well, and experiments in animals and some humans are going on.
Right, right. But this is a variation of the laser, as you would say.
Most common energy we use is radio frequency energy. I would say it's closer to microwave energy.
Awesome.
And that is considered to be a little bit more effective than antiarrhythmic medications to keep the patient in normal rhythm. But it is an invasive procedure with certain risks, side effects. So a specialist can always brainstorm and figure out positives and negatives of either of the approaches.
Great. And I'm so lucky to have one of the world-renowned experts in atrial fibrillation ablation present with us to educate us. Last and final question, Dr. Ivanov, is what are your thoughts on holistic or natural approach for relief of atrial fibrillation or prevention of atrial fibrillation and palpitation?
Well, you can do something to decrease atrial fibrillation burden or possibly even prevent it if you do maintain healthy lifestyle. Unfortunately, a lot of my patients have obesity and sleep apnea,
Right.
and obviously they're at a much higher risk of developing
Right.
atrial fibrillation. I beg your pardon. Some of my patients use excessive amounts of alcohol or caffeine. So controlling these risk factors may decrease atrial fibrillation burden or sometimes even prevent it. But as we discussed before, most of the time,
It's unknown.
we have no idea why atrial fibrillation comes. Some aging of the heart, this is what
That's
most
true.
commonly is responsible for
Responsible.
atrial fibrillation.
Right, right.
When we find cure for aging, we will find cure for atrial fibrillation.
So I'm happy to say that he's one of the experts in the country on atrial fibrillation. So if you can educate our viewers, what is atrial fibrillation?
It's commonly called irregular heartbeat.
Right.
The heart is a muscular sac that pumps blood through the body, and it has 2 top chambers and 2 bottom chambers.
Right.
Actually, when I talk to my patients, I like drawing.
Awesome.
Look, so if this is your heart, it pumps blood through the body, and it has 2 top chambers and 2 bottom chambers. And usually they work in synchrony because there is a little pacemaker on top of the heart in all of us, and it drives the heart regularly. Electricity spreads through the heart to the right and to the left side evenly and synchronously, and the heart performs adequately. In atrial fibrillation, instead of normal cardiac pacemaker driving the heart at a normal regular beat, there are multiple little pacemakers firing at the same time, driving the top chambers of the heart into fibrillation, which means quivering, fluttering of the top chambers of the
Right.
heart. So when it happens, these multiple short circuits in the heart drive the heart very fast,
Right.
irregularly, and the heart start performing suboptimally.
Right, right. You know, when I explain to my patients this, I have my own way of saying things. I tell them that you think of your heart as a house. You have the attic, all right, the 2 top chambers, and you have the 2 bottom chambers, okay? In a normally beating heart that is in sinus rhythm, the top and the bottom chambers are married to each other. When it goes into AFib, they are divorced. So the top chamber is doing its own thing and the bottom chamber is doing their own thing. And again, it is caused by a disbalance in the electrical system.
And
so
there's a lot of chaos in the
exactly.
attic.
There's a lot of chaos in the attic which disbalances the whole system in very, very simple terms. Excellent, excellent explanation. So again, what are the triggering factors or symptoms that can cause AFib?
Well, the symptoms of atrial fibrillation may be absent. The patient comes to us and we
Right.
tell the patient that they have atrial
AFib.
fibrillation. Sometimes when the heart does not perform optimally, people feel breathless,
Right.
they feel palpitations, for example, they feel fluttering in their chest,
Right.
rapid and irregular heartbeat.
Right.
When they check their pulse, they feel that it's irregular
Regular.
and rapid. Sometimes people feel dizzy.
Right.
Sometimes people become short of breath with minimal exertion or even at rest.
Right. Right.
And this is the symptoms of atrial fibrillation. What can trigger atrial fibrillation is much more mysterious. Most of the time, we never know.
Exactly.
It comes and goes as it wills. It's a very chaotic, unpredictable arrhythmia. However, there are 2 very common and very well-known triggers that can increase the frequency of the episodes. One is alcohol.
Big
We
time.
used to call it holiday heart syndrome.
Holiday heart syndrome, right.
Because people had good time on the weekend, and
Yeah.
on Monday morning,
That's
the whole
it.
emergency room was full of patients
Right.
with AFib.
Right.
And the other very common trigger is a pulmonary disease. Anything wrong with the lungs may trigger atrial fibrillation.
Right.
For example, smoking with subsequent development of
COPD. Right.
or obstructive sleep apnea.
Oh
When
my
people
God, that's
fall
a
asleep,
very, very
stop breathing, oxygen in the blood drops, the heart goes into AFib.
right.
Very common. And unfortunately, obesity that leads to sleep apnea and can trigger AFib.
I completely agree with you. In most cases, the cause is undiagnosed. So again, one of your other expertise is that little thing that you put in patients' chest to monitor them whether they are having episodes of AFib, and if so, what is the burden? So can you tell us a little bit about what we call the loop recorder or the 24/7 monitoring?
Well, so how do we diagnose AFib? As I mentioned before, a lot of AFib episodes are completely asymptomatic. People don't know that they have them.
Right.
Well, we need to catch AFib.
Exactly.
It's very difficult to catch it on the EKG done in the office.
Randomly, because
it represents 5 seconds of your life.
Right.
What if you had AFib 1 hour before or
right,
1 hour after
right,
the visit?
right.
Sometimes we give a Holter monitor for 24 hours. But what if AFib happens 2 days later?
Right.
Well, in those cases, we may give an event monitor that the patient can carry around for up to a month. Well, what if AFib happens 2 months from now?
Exactly.
As I mentioned, it's chaotic, unpredictable arrhythmia.
Right.
Well, more and more we begin to insert under the skin special little recorders. It's like this little pin on my pen. And it's a 5-minute procedure. Essentially, we just clean the chest with iodine, numb up the skin so it doesn't hurt. And with a special syringe, we inject this little pin under the skin, right here in front of the chest, very close to the heart. This device keeps recording the heart consistently, 24/7. And the battery lasts for up to 2 or 3 years.
Wow. Wow.
So if the patient ever has atrial fibrillation, we will know it because we can check it with special computers on a regular basis.
Alex, the way you're describing to me, it sounds like I can walk into my electrophysiologist's office and you can just give me a little local anesthesia, put the device in, and I can walk out and drive home.
Well, to me, frankly, it's a 5-minute procedure.
Wow.
And then we kind of know everything about the patient's heart rhythm. We call them loop recorders because they keep recording, keep looping, keep recording. And it provides us with a lot of information that helps us to manage patients with AFib.
Great. The next question, Alex, we had alluded about it a little bit in the earlier part of this episode. What do you think about the Amazon sold heart monitoring devices or the Apple Watch app to detect AFib?
If atrial fibrillation is symptomatic with palpitations, they are acceptable devices that can document the presence of AFib.
Right.
The problem with those devices are twofold. One is artifact.
Right.
Sometimes even we doctors cannot really tell if it's atrial fibrillation or simply an artifact of the recording. And most important problem is 7 out of 10 episodes of AFib are asymptomatic.
Right.
So
right.
even if you use those devices, there is a significant chance that you will never know that you have AFib, even though you use them regularly. That's the main problem with those devices.
I completely agree with you, Alex. Friends, we will take a short break, but when we come back, we're going to talk about the treatment approach to atrial fibrillation with our expert, Dr. Ivanov. See you back soon.